Hello, I am Takuji Iwashita from First Department of Internal Medicine at Gifu University Hospital in Japan. I am here to present a video abstract regarding a paper which is published in Coming Age of Clinical Gastroenterology and Hepatology, titled Use of Samples from Endoscopic Ultrasound Guided 19-gauge fine needle aspiration in diagnosis of autoimmune pancreatitis. In the diagnosis of autoimmune pancreatitis, histological techniques are used to distinguish autoimmune pancreatitis from pancreatic malignancies and to confirm the etiology of pancreatitis. Endoscopic ultrasound-guided fine needle aspiration is a well-established technique to obtain pathologic specimens from the pancreas. However, it is unclear whether specimen obtained by EUS FNA is adequate for the histologic diagnosis of autoimmune pancreatitis, because the histologic features of autoimmune pancreatitis have been investigated mostly in surgically dissected specimens. In this retrospective study, we evaluated the yield of EUS FNA with a conventional 19-gauge needle for the histologic diagnosis of autoimmune pancreatitis. 44 patients who were clinically diagnosed with autoimmune pancreatitis and underwent EUS FNA with a 19-gauge needle from January 2004 to September 2010 were evaluated in this study. The FNA specimens were reviewed by histologic analysis. AIP was diagnosed based on the presence of lymphoplasmacytic sclerosing pancreatitis or IgG4 positive plasma cell infiltration. In histologic analysis, the specimen amount was inadequate from 3 patients. Among the remaining 41 patients, histologic examination revealed storiform fibrosis with infiltration of lymphocytes and plasma cells in 38 patients, but only dense fibrotic changes in 3 patients. Among those with storiform fibrosis with lymphoplasmacytic infiltration, a diagnosis of lymphoplasmacytic sclerosing pancreatitis was made in 17 patients because the presence of lymphoplasmacytic infiltration around pancreatic ducts and obliterative phlebitis was detected in 23 and 21 patients, respectively, and positive findings for both were observed in the 17 patients. Extensive IgG4 positive plasma cell infiltration was observed in 5 patients, including positive findings for lymphoplasmacytic sclerosing pancreatitis in 3 patients. However, there were no findings indicative of neutrophilic granulocytes infiltration consistent with granulocytic epithelial lesion. Therefore, 19 patients were given histologic diagnosis of autoimmune pancreatitis. In conclusion, EUS FNA with a 19-gauge needle is a safe and reliable procedure for obtaining pancreatic sample for the histologic analysis of autoimmune pancreatitis. Though it does not have a high diagnostic yield, it might be useful in cases without typical features of autoimmune pancreatitis because it would allow patients to avoid unnecessary surgery. Thank you.